webinar is being presented by Dr. Doni Wilson and is being sponsored by Cometis, which carries a great line of bioherbal skincare. So just a quick about Cometis. Cometis is a research-based pharmaceutical and dermo-cosmetic company, and it develops and markets skincare products that are derived from botanical sources. The company was established in 1998 by a group of traditional Chinese medicine practitioners, and they specialized in dermatology with a vision to leverage the efficacy of herbal formulations for pharmaceutical standards and requirements. Cometis has over a decade of experience in formulation and development of herbal-based products, and it holds its course towards medical device creams and botanical drugs. This special webinar is being presented by Dr. Doni Wilson. She graduated from Bastyr University in 2000. She specializes in stress response, leaky gut, and endocrinology. She is the author of the book, The Stress Remedy, and is the creator of the Hamptons Cleanse. And so now we'd like to turn the time over to Dr. Wilson.
Thank you. Thanks for having me. And thank you all for joining in today. It's I always, you know, it always feels like it's almost like we're in a room together, but there's no lights on, so we can't see each other. But I'm excited to share this information with you. So as the title of the lecture is presented, we want to look at this as the vicious cycle of skin, all different kinds of skin healthcare issues. And so this is one thing that I always really like to do, is be able to step back and look at the big picture, and also be able to apply naturopathic medicine and nature cure by doing that, instead of just trying to suppress symptoms. We want to look bigger and understand why these health issues are coming up to begin with, and what we can do to change the pattern. So many people, 89.5 million people, have various types of skin issues, from acne to psoriasis and more. When you look at the research, it definitely shows that stress can be, oftentimes it's thought of as an aggravating factor. You know, if you're under more stress, you're more likely to have eczema come out, for example. But I'm going to show you how it can even be more of the pattern than that. And what my approach is by addressing this vicious cycle at certain points, then we can actually break the vicious cycle. And using topical treatments, and I'll show you some of the Cometis products and how they can help break the vicious cycle by also intervening in very specific ways. So we'll come around to that as well. But first, let's look more at what I'm talking about as a vicious cycle. So again, if we look at it from the perspective of stress and how stress comes in and the way our bodies respond to stress with cortisol and adrenaline, what you see in the research is that the stress response affects what I call 4 core systems. And we're going to talk more about that and how they then lead to what I call 3 problem networks. And it starts to spin this cycle, because then the symptoms that result, as a skin rash, for example, actually end up creating more stress for the body, and that's where the vicious cycle turns. Is the stress creates a situation in the body where the rash happens, and then the rash itself becomes a stress that continues the pattern. So here's the 5 steps to managing this vicious cycle, VC, vicious cycle, and we're going to go through these 5 steps today. So first, identifying the specific pattern, and this is very individual. Even though we all are exposed to stress in various forms, we have very individualized ways our bodies respond to stress. And you're going to hear me talk about stress and the stress response a little bit different, perhaps, than the ways you've heard about it in the past. That's based on my clinical experience. I've been a naturopathic doctor specializing in these areas for 14 years. And the research in my practice, I researched cortisol and adrenaline, and I'm going to tell you more about that and what I saw. But a lot of it starts by saying that we have very individual ways that our bodies respond to stress. I call it like a fingerprint of a stress response, and that can really help us understand where a person is in this moment in time and what their bodies need in order to get back to a healthy stress response. Okay, let's see. And it's also to say that it's not like we're trying to eliminate all stress. We want to understand what is optimal stress and optimal conditions for each individual. So these are common types of stress. We're used to thinking of stress as a major trauma, a death, a divorce, a accident, some sudden change, whether that's a move or a lifestyle change, a job change. It can also be recurrent stresses, such as a health issue, or skipping meals or not getting enough sleep, which is what I call synergy disruptors. So here's a list of what are synergy disruptors. Again, these are not commonly thought of so much as a stress, but they certainly are a stress on the body. Right? When a person, doesn't get enough sleep or at a different time of day, the body is going to have to respond in a different way, and the hormones shift and the immune system shifts. We know that, right? We can see that in patients. If a person is skipping meals, or they're having meals that are too large or too high carbohydrate, even if they're eating foods that are triggering the immune system, whether that's a food allergy or food sensitivity, if they're intaking substances, whether that's caffeine, alcohol, sugar, toxins that are just making more work for the body, is a stress. Even medications can be a stress, as can symptoms and infections and inflammation. So those are what I refer to as synergy disruptors. And here, I think many of you are familiar with the HPA axis, but the HPA axis is the system where the stress comes in, the brain responds, the sympathetic nervous system and the adrenal glands respond, and what should happen is the cortisol feeds back and turns off the stress response. But that X shows you where, if that stress response is being constantly triggered, then that system isn't working as well, and the cortisol, the stress response isn't turning off, so a person may continue to experience stress even if there's not a current stress occurring. And this is where, when I'm mentioning the 4 core systems that get affected by cortisol, they're the endocrine system, or really any hormones in the body, the digestion, immune system, and the nervous system, or the neurotransmitter levels. So when you start to think about it, if a person's under constant stress, which most of us are, and the cortisol level is being triggered often, then it's going to affect these 4 systems. Even if the cortisol is too low, it's going to affect these 4 systems. And that could lead to, in the case of hormones, it can lead to hormone imbalances, whether that's thyroid or ovaries or insulin, you name it. Digestion can lead to various digestive issues where it's just not digesting food, all the way to, whether that's more likelihood of developing gastritis, to irritable bowel syndrome, or inflammatory bowels, or dysbiosis. In the immune system, it can make it more likely that a person has allergic responses, autoimmune responses, susceptibility to infections, and even cancer. Research shows us that those are all more likely to happen when a person's under stress. And in the nervous system, it can lead to various neurotransmitter imbalances. So we'll talk more about that. But I just want to have you get a sense of how does this vicious cycle perpetuate itself. So if the 4 systems then continue, they can lead to other issues, for example, that I've pulled out more strongly as 3 problem networks, being leaky gut, carbohydrate imbalance, carbohydrate metabolism imbalance, which I'm going to talk about more, but that has to do with anything. It doesn't have to be diabetes. It can be anything in that spectrum where insulin and carbohydrates are just not being managed well by the body. And the 3rd problem network is the adrenals and cortisol. So you have this as a chart to show you how these three problem networks actually perpetuate each other. And the way that they trigger each other is happening because of various hormones or cytokines and neurotransmitters that send the message of stress and recreate the pattern. So we know from research that these things increase each other. So the more leaky gut, the more likely adrenal distress, the more leaky gut, the more carbohydrate metabolism issues, and you can see this becomes this pattern of problem networks. So in order to help understand, for say a person walks in with eczema or psoriasis, and you want to understand where are they in this vicious cycle, then there's some tests we can do to assess. And based on what we've been talking about, one of the first would be cortisol levels, because we want to see how is this person's stress response responding, where are they, and therefore where can we help them get their cortisol back into optimal ranges. I also find measuring neurotransmitter levels is helpful, right? Because then you can see how the nervous system has been affected. Measuring IgG, IgA antibodies to foods is helpful, because then you can see both the digestion but also the immune system. How are things responding there? And these are especially tests that are beyond the standards, you know, beyond a CBC and a chemistry. This would show us, okay, where can we see that this person is, which of the 4 core systems, which of the 3 problem networks is really beginning to be a major part of this vicious cycle for this person. You might need to do a stool analysis. You might even need to do a cytokine panel or a leaky gut panel if you need to know more specifically about leaky gut. Also looking at malnutrition or nutrient deficiencies, detoxification pathways. You know, these tools all help us understand for this person where has the stress been affecting them most. So I wanted to take a minute and just ask all of you, how many of you use cortisol testing in your practice? So we're going to do a little, it should come up on your screen here where you get to answer that question. And then Leslie's going to calculate and tell us to see how many of you are thinking of it this way too already.
So it comes in at 33% yes and 67% sometimes.
Sometimes, okay. Okay, great. So some of you are already like thinking, yeah, where's the cortisol when someone comes in with a skin issue? So maybe the more we discuss it today, you can see if this may be something you want to even consider more in your practice. All right, let's see, did the poll end? Let me see if it'll let me go forward.
Yeah, the poll's ended. You can go forward.
Okay, let's see. It's giving me a bounce back. No? Oh, there it went. Oh, good.
Okay, good.
Okay, we're on. Okay, so we're going to talk more about cortisol and adrenal distress, but that's where, you know, the more we can think about this bigger picture of how stress comes in and sets a person up for the skin issue, which is the symptoms, but the more we can manage from the inside and break this vicious cycle, the more we can help them recover. So this step 2 is optimize the stress response. So this is perfect. We're going to talk more about cortisol. Uh-oh. It doesn't want me to go. Why? Have any idea, Leslie? I'm going to try escaping and coming back in. Let me try that. Let's try this. Okay, there we go. Okay, so optimizing the stress response. You can see I put an arrow at the top of this vicious cycle here. That's where we're starting. We want to support the body to be able to recover from stress effectively. So here we have a normal healthy cortisol curve, right? So it would be high in the morning and gradually down through the day. And you can see again where this HPA axis, you know, the stress comes in, it triggers the cortisol, but it should be a relatively brief situation. You know, I often will give the example of the alarm going off or the horn honking. You know, the stress response is going to get triggered, the cortisol can spike, but then it should all cycle back and correct itself and come back to this nice healthy curve. But depending on the stresses that a person experiences, and by the way, the way a person responds to stress is even partially genetically determined. It's determined by even before they were conceived and while in the womb and in early childhood. So again, it's a very individualized experience of how this cortisol responds to stress and how it corrects itself when the stress is gone. So I wanted to show you some examples. This is an example of a patient who has rather severe eczema, and you can see that in her case, so where you would want her cortisol to be would be between the two gray lines, and she has a relatively low cortisol in the morning. She's the red line, and it stays low most of the day, but it ends up too high in the evening. And this is one thing I find is a lot of times if we don't test this, if you were just looking at her and you're seeing this eczema and you're seeing this inflamed and red, someone might think that her cortisol is high, but actually in her case it's not high all day, it's only high in the evening. So really the only way to measure, or the only way to know what the cortisol is to measure it. That's also what I found in my study of 127 patients. Is I wanted to see were there any symptoms that could tip me off to where their cortisol level was. You know, was it if they had headaches, or if they had fatigue, or if they had, if they had skin issues, was that going to tell me their cortisol was high or low? But what the study showed is it really doesn't. There were no symptoms that correlated with the cortisol levels, and the only symptom that even slightly correlated is fatigue, and that only matched up when a person has low cortisol and low adrenaline. They're more likely to have fatigue. But that's the only situation, and people with high cortisol can also have fatigue. So you really can't guess the cortisol by the symptoms. You really need to test it. And here you can see that her norepinephrine and epinephrine, which is her adrenaline levels, are in this range, and even at the high end of the range. You would want it to be in the middle here, in the gray. And so even though her cortisol is running on low most of the day, her adrenaline is on the high side. So you really want to look at both. If you can look at cortisol and adrenaline, you get an even more complete picture of this person's stress response. So let's look at another one. This is a patient who has acne, and you can see her cortisol starts off in the range, and then it goes way up high and stays pretty high all day long. Even though it kind of follows a curve downward, it's still way above the curve. And her adrenaline is very low. So you can see it's like, wow, here's this piece of information that you wouldn't have gotten from blood work, but now you can see that these are the stress messengers that are, I call them stress messengers, that are continuing the pattern of stress and the vicious cycle in her system. And the more we can correct these, the more it would also benefit from the acne. We'll talk more about how to address cortisol levels and adrenaline, and I'm always happy to go into that in more detail because I think most of you know there's a lot of products out there that can help, for example, to lower cortisol levels and raise adrenaline levels, and you want to do it very carefully because I would usually start by lowering a high cortisol before raising a low adrenaline. But because if you jump right in to raise adrenaline, you might then overstimulate the person. So you want to go about it carefully. But these levels can be corrected using nutrients and herbs, as well as lifestyle factors. And that's what I wanted to show you here is I have this summary chart of the 5 approaches for transforming stress. These are all based on research that show that these 5 areas not only help lower cortisol when it's low, but basically help bring the body back to a healthy stress response so that when a person's stressed, they're more likely to come to a healthy cortisol curve instead of high or low. So what I call connecting with oneself, connecting with others, opportunities to connect with others, opportunities to give yourself a break. Even if it's a short break, it doesn't have to be long. Even 5-10 minutes can be enough to help correct a stress response. Enjoying nature, whether that's from the outside or from the inside, but enjoying nature definitely helps correct our stress response, as well as what I call experiencing emotion, because it has to do with experiencing all emotions and processing emotions in whatever way works best for you. So I like to mention these as well as ways to help people manage their stress levels. But let's move on to number 3, which is addressing the 4 core systems. again, here's our vicious cycle, so we're over here on the right. Now the 4 core systems are endocrine, digestion, immune system, nervous system. And you can see here in this little picture how they sprout out with these different symptoms. And now in this situation, we're thinking of skin rashes, right, as the symptoms that could appear from really any of these. A person could have a skin rash, right? But if we just chase after the skin rash, we're not really managing the underlying issue. So what I'm going to encourage you to do is now, when you see a person with a skin rash, ask yourself, are any of these 4 core systems involved, and how can I assess them to see if they are? So you could be checking cortisol level, you could be checking blood sugar levels and insulin. Again, I often find that blood sugar, like say if you check a fasting glucose, it's probably normal, and even the insulin level could be normal. But still, if a person is eating in a way where maybe they're going long periods of time without food, or they're having large quantity of food, their blood sugar level could go a little bit high and dip a little bit low. And we know that even those within normal range fluctuations can be a stress to the body. So we'll talk more about that. You can look at hormone levels, including hormones like leptin have been shown to be interrelated. So you want to be considering all these different hormone levels. And then we're not going to go into the detail of how to address all of those things today, but then you would implement your preferred way of helping a person to, whether that's dietary or lifestyle or nutrients and herbs and homeopathic remedies and so on, to help stabilize whichever systems are involved in their case. For example, for digestion, it might mean supporting digestive enzymes. It might mean being anti-inflammatory or addressing leaky gut, or if they have a dysbiosis or constipation, you would want to address that. And addressing food sensitivities and helping them, avoid the foods. Often I find that practitioners will be thinking food sensitivities with skin rashes, but what's surprising to me is a lot of times patients are not thinking that way. So a patient might come into me and have eczema or psoriasis, but they are not realizing that what they're eating has anything to do with what's happening on their skin. So this area of going right to the digestion is often an area where patients just really have an eye-opening, where they go, wow, who knew that my digestion and my food had anything to do with my skin? And so this is a really important area to address and can make a big difference for a person right away. But it does involve often, some dietary changes that they may need support with. Then another core system is the immune system. So depending on the person, you might need to consider these areas if they have a susceptibility to infections, especially if the skin issue is a infection. If it's even with acne, I think of it as their immune system needs help fighting off infections in their follicles, or infections anywhere in the body, or if they've been exposed to antibiotics and they have a yeast infection. Again, it needs to come back to how do we support their immune system to function better. Or anti-inflammatory, or is it a histamine or autoimmune issue? You're going to address those things. And as you do, you're going to be helping to break this vicious cycle. Same with the nervous system. If you do a neurotransmitter panel and you see there's an imbalance of serotonin or other neurotransmitters, by addressing them, you're going to be working in this system of addressing the vicious cycle. So that was step number 3. And on to step number 4, which is looking at these 3 problem networks. And again, this is something that I have started calling them because to me, I see that they create this bigger pattern of the vicious cycle. So if you look at it this way too, sometimes you can start to see how if you have these 3 at the bottom cycling around, adrenal stress or adrenal distress, because the person's under stress and their stress system is no longer rebounding as well, plus maybe then they have leaky gut going on, whether that was because they were exposed to antibiotics or gluten or whatever cause they have leaky gut. That's triggering more inflammatory responses throughout the body, and that's also making it more likely that they're going to have issues with their carbohydrate metabolism. So this is all cycling around, and it's affecting the 4 core systems, which then results in this skin rash. So like we talked about, if the cortisol levels are off, you're going to want to address them. When they're too high, help lower them. If they're too low, help get them back up again. So that would be one part of the plan, especially in most cases I find that that's part of it, but rarely do I find that that's not part of it. Leaky gut, which I think you're all familiar with, but the idea that this is my picture, by the way, from my book, The Stress Remedy, where I show on the left side more of a healthy version of the digestion, where the food's getting digested and the cells are all lined up in the small intestine so that only the nutrients can get through. And on the right side, where those small intestinal cells have been damaged, again, this is microscopic, although in my picture it doesn't look microscopic, but it's allowing food to get into the area where the immune system starts reacting to it. And when the immune system, I find mostly IgG antibodies to be where I see the immune system starting to react to foods. Now, some people will just think of it as, oh, okay, I need to just eliminate that food. Say the person's reacting to dairy proteins, casein and whey, so then you help the person avoid casein and whey. At the same time, I'm thinking, why are they reacting to casein and whey? And especially if they show that they're reacting to a lot of different foods, to me that shows that there's significant leaky gut, because the only way that the immune system is going to be reacting to those foods is if it's leaky in the intestinal lining. So one step is removing the foods they're reacting to, but we also have to be paying attention to leaky gut and supporting the healing of leaky gut, which also includes balancing the healthy bacteria, because if the healthy bacteria are off track, and then you're only going to perpetuate leaky gut. So I'm just talking about that briefly today, but that's an important part of this. I am curious, though, and we'll do another little poll here about how many of, the way I was going to ask it is how many of you avoid gluten, because to me it's the more, the more you understand the troubles that gluten can cause, the more likely you yourself might even be avoiding it, let alone recommending it for patients. So this is a curiosity of how many of you avoid gluten yourselves.
Okay, so the poll results have been shared. It's sitting at 50-50. 50% say yes, they avoid it in their own diet, and 50% say off and on.
Off and on. Okay. Okay. Thank you. So, so those of you who maybe haven't, tried avoiding gluten 100% for like a month, I might suggest it, because, I find that it's only when, for myself, it was only when I decided to eliminate gluten from my diet that it became very clear to me how my body was reacting to it. And I've at that time figured out that I have gluten sensitivity, and that was, oh my goodness, probably 6 or 7 years ago. But I think it really helps too, because when you experience as a practitioner where gluten affects your body, because it can be different for every person, but when you start to experience it then, and you've been through that process, it's going to be a lot easier for you to also support your patients and see where this may be playing a role for your patients too. I think I have to escape again and come back. Let's see. Here we go. So that'll be a fun experiment for you, but I think it's also helpful if you were, to me, gluten plays such a role with not only causing leaky gut, but triggering inflammation in the body, that, it's, to me, it's such an important consideration with skin issues. Whether or not it's celiac disease, it can be a gluten sensitivity, which is way more common. The celiac is about 1 in 133 people, and gluten sensitivity can be at least 1 in 4 people, if not more. Plus, we know that no humans can really digest gluten, so even if the immune system isn't getting triggered very much, it's still going to be a challenge for the digestion. And if there's symptoms anywhere, especially on the skin, it's saying to me there's something triggering inflammation, and gluten is such a common trigger for inflammation in the body. So that's why I like to emphasize it. But let's go back here to looking at, so here was just a summary of the 3 problem networks. So we covered the stress response and we covered leaky gut, but I wanted to just mention also the carbohydrate metabolism, why I think it's so important as a source of inflammation. So when we think about, you know, this cycle, for example, where say you have excess cortisol, which is from the adrenal distress, right? And it's going to inhibit insulin function. So a person who has high cortisol is going to have a lot more likelihood of gaining weight and fat storage because their insulin function is going to be down. But the more that they have, you know, fat storage or weight gain or obesity, then it perpetuates this pattern, and we know that that situation increases inflammation. So the more the fat cells exist, the more inflammation and cytokines, the more likely there's going to be insulin resistance, and it goes round and round. So this is why I would consider this to be one of the 3 problem networks, and also one area that I would consider, again, not usually the first thing you would think of when someone comes in with a skin rash, but once you start, you know, looking into it with patients, I think you'll find, wow, even if they don't have diabetes or weight gain, they may be having blood sugar issues that are perpetuating inflammation and cytokine levels. So the way I talk about it with patients is really helping them to understand that our bodies don't have a way to, they don't have a holding pattern for when you eat. Once you eat, the body has to process it. The insulin needs to get that glucose moving into cells. And if you overwhelm your insulin, if you eat more carbohydrates than your insulin can manage, it's going to be, got to have something done with it. And usually that means that the liver is going to need to put it into cholesterol, body fat, or fat in the liver, none of which you really want more of. So, of course, we want a little bit of cholesterol, but in this situation, you don't want a lot. So what you want to do is only feed yourself in a way that allows your insulin to function optimally. And so I help patients to understand, you know, what a serving size and how to balance carbohydrates with proteins, and to eat every 2 to 4 hours so that they can spread their food over time and optimize the way their body processes carbohydrates. Okay, so that was number 4. So let's move on to the number 5 part of breaking this vicious cycle, which has to do with at the location of the skin rash in this situation where we're talking about skin. So, you know, topical relief for the skin condition can help the vicious cycle. A lot of times, you know, we think of something topical as only being a suppression of the skin issue, and there certainly are topicals that are just suppression, but I'm going to show you some that are not just suppression, that can help actually break this vicious cycle and stop the inflammation and the cytokines that are perpetuating the pattern. Plus, it helps this patient because emotionally and physically they can get some relief. Maybe it's itching, maybe it's burning, maybe it's pain. If we can get this to decrease, then their stress level decreases, and that also helps break the vicious cycle. So I'm going to show you some of the Comitas products, which I'm not sure how much you're familiar with them already, but I'll start to show you and you can always learn more. They have herbs in them, and we're going to talk more about that, but they have been researched to show how they affect the skin. So here's a picture to just kind of remind us of where we're looking here on the skin and all that's happening there in terms of hydration and where cytokines can be triggered and where inflammation can happen. So again, Comitas makes topical herbal products that have been researched. And so that's pretty cool to be able to see how these herbs are standing up to things like cortisone treatments. And here at least we're helping the immune system instead of just suppressing the immune system with a steroid. We can actually turn off the cytokines we don't want and help the cytokines we do want. And these are 4 of the basic Comitas lines. So we're going to talk a little more about them. They're slightly different formulas for slightly different purposes. So this one that's called Topic, you can see these herbs in here, and like Leslie was mentioning, originally was formulated from Chinese herbalists. But I think you're going to be familiar with some of these. For example, this first one that's called rheum is rhubarb. But I wouldn't usually think of rhubarb as something to put on the skin. So I think this is very exciting to see an herb that I'm not used to seeing. Scutellaria is often thought of as an anti-inflammatory herb, but I really haven't seen it in very many skin products. And then this one down at the bottom, licorice, which is definitely much more considered an anti-inflammatory herb. And I love to see it in a topical formula. But I wanted to emphasize the rhubarb because just to learn a little bit more about it as an herb that's anti-inflammatory, and that the research actually shows that it can inhibit these inflammatory cytokines. It's also antibacterial, so specifically for staph, but other bacteria as well, and it can have an antihistamine activity and wound healing properties as well. Who knew about rhubarb? My goodness. So this sounds really great to be able to have this in a topical product, I think. So let's look at this one. This is a different formula, the PSO Metis formula. Again, you see the rheum in there, that's the rhubarb, but we also have this first one, which is indigo, and then there's some other herbs we're going to talk through. Again, licorice down at the bottom, and angelica. But you can see in this chart how all of these herbs in the formula have an immune modulatory activity. So isn't this great? I mean, here we are talking about inflammation sources throughout the body, and we can, by touching into, wherever this inflammation is coming from for this person, whether it's from their gut, from their carbohydrate metabolism, from the cortisol levels, we're going to manage all of that. But here at the local area on their skin, we can also help reteach their immune system to come back into balance, as well as decrease, this has an anti-irritant effect, antioxidant effect. So all the things you would basically want on the skin, here you have right in one formula. This one I wanted to show you a little bit more about indigo, because this is another one of those herbs that I wouldn't usually have thought of for skin. But look at this, it's used for treating skin inflammation and eczema, and it can affect the proliferation and differentiation of the cells, and it can inhibit T cells as well as inhibit pro-inflammatory cytokines. It's like wonderful. It's like, yay, it's great to have that in a formula you can use. Here's another one of the formulas, AC Metis. Again, you can see the way that these herbs work. A lot of it is anti-inflammatory, but also antimicrobial, wound healing, antihistamine. And in this formula, you see that scutellaria also helps with sebum regulation, which could be very helpful for something like acne. Analgesic when something's inflamed, that would be really nice. That's chrysanthemum. And there's this other herb here called, it's the soap nut, Sapindus fruit, which is also used in several of these formulas for helping as antimicrobial and anti-inflammatory, which makes sense for acne as well, right? We were talking about how acne can just be little festering infections and they need a little help stopping that. This would be a way better option than using an antibiotic that then may throw off the digestive tract and cause leaky gut and perpetuate the pattern. Okay, so here's Sevometis, which is, you're going to see some of the same herbs in a little bit different combinations. But you can see where this one could be also helpful for different skin issues. So those are those products, and I'm sure Cometis can, if you're interested, give you even more information. You can see they come in different types, whether it's a lotion, whether it's a cleanser, and so on, so that it can be in a form that that patients can use. So again, the whole idea here is how do we break the vicious cycle, and being able to be anti-inflammatory and address the symptoms at the local area is definitely part of that, breaking the vicious cycle. As well as addressing what's going inside this person that's making it so their body's susceptible to having these inflammatory skin reactions to begin with. Okay, so here's contact information for both me and Cometis. And Leslie, did you want to
Yeah, a couple of housekeeping things. First is that everybody who attends will be contacting you via email to send you some samples of Cometis. And then there was a question that came up that
Great.
I'd like to have you answer. It says, what labs do you use to measure cortisol and neurotransmitters?
Oh, thank you. Okay. And I don't have any, affiliation. It's just, so if I mention anything, I wanted to make it clear that it's not to my benefit. But, and there are several labs that can do a salivary cortisol panel. So, you can definitely look at all the options. I often go to Pharmasan for doing those kinds of panels because I like that Pharmasan can do salivary cortisol at 4 times during the day and the adrenaline and neurotransmitter levels in the urine. There are other labs, though, that also offer that kind of testing. So, but that's what I usually use. Any other questions? I'm happy to answer.
That was the only one. If anybody has one, you can type it in. If not, we'd like to say thank you for your time, and thank you to Dr. Wilson for this very informative webinar.
You're welcome.
All right. This ends this webinar, and thank you very much to everybody for attending.